Good morning, everyone, and welcome to the Tri-Valley Nonprofit Alliance Anti-Poverty Collaborative event, aptly titled Bridging the Gap. I want to thank each and every one of you for being here today. Your attendance signifies a collective effort, the desire to make a difference, and the commitment to address the pressing challenges of our community. I would like to extend our sincere appreciation to our event sponsors, Supervisor David Hubbard, represented by Dublin Mayor Melissa Fernandez today, and Sandia National Laboratories. Without your support, this event wouldn't be possible. Bridging the Gap isn't just a phrase or title for today's gathering. It embodies our continued pursuit to confront and address multifaceted issues our communities face, from poverty to healthcare, education, affordable housing, food security, and economic justice. And speaking of bridging gaps, we have an incredible panel today. Dr. Tiana Moore from the Benioff Homeless and Housing Initiative, Jim Pugh from the Universal Income Project, Dr. Larissa Estes White from the Governor's Office of Planning and Research. And these are individuals who have been at the forefront of combating poverty and inequity. I can't wait to hear their enriching discussion. Sheila Burks will be moderating. We also have updates to share with you regarding our recently revised Just Getting By in the Tri-Valley Data Profile, which James Paxton is going to do for you, and more insights on various topics that you'll find truly enlightening. I urge you all to share this initiative with anyone interested, be it media, legislators, businesses, nonprofits, or individual change makers. Together, we can truly bridge the gaps. Before we dive into our main program, I wanted to share some news. In spring 2023, Alameda County awarded Tri-Valley Nonprofit Alliance a 2-year, $1.4 million grant for a groundbreaking project, Livermore Connects. So let me see. Yeah, okay. So as a coalition, we're joining with Access Community Health, Open Heart Kitchen, Tri-Valley Haven, and CityServe of the Tri-Valley. Our mission with Livermore Connects is to significantly improve health and economic outcomes for our most vulnerable populations. We've already hit the ground running with our first official outreach event in August with more than 700 attendees, and our next event is just right around the corner with La Familia at Rincon Park. Please join us on November 4th as we recognize the Day of the Dead. So we hope that you will join us, and we're excited to be partnering with La Familia and the coalition all of that again. So, let me see. All right, and now, without further ado, I would like to introduce TVNPA board member James Paxton. He's here to shed light on our Just Getting By in the Tri-Valley report. James.
Good morning. It's a pleasure to see all of you here this morning. I have to say it's a little intimidating being on a stage with an orchestra pit. I think this is a first for me. Who knows, maybe one day I'll actually warrant the actual orchestra, so we'll see how that goes. It is really great to have you here this morning. We are very pleased to have you join us for this important discussion that we are continuing today. In 2014, Kaiser Permanente reached out to a number of local organizations to start the Tri-Valley Anti-Poverty Collaborative work. What I think I still find as sort of an innovative thought that caused Kaiser to take action was that they recognized that poverty was a public health issue, and as an organization that was devoted to addressing public health issues, they wanted to do more to do this. They had led a successful effort in eastern Contra Costa County to bring people together to work on issues surrounding poverty, and they wanted to do the same thing again in the Tri-Valley, and hence the Tri-Valley Anti-Poverty Collaborative was born. A lot of other interesting things were happening in 2014 at the same time. It was the 50-year anniversary of the War on Poverty. There was a very important effort that got started in Alameda County by Supervisor Chan, her All in Alameda County effort, and we're very fortunate to have Dr. Estes with us here this morning, who has devoted a considerable amount of time and talent to that work. In addition, there were some very interesting studies being performed. One of them was by the Brookings Institute, Elizabeth Kneebone and Alan Berube had produced a very, very interesting analysis of the specific challenges of poverty in the suburbs. And in fact, they had used communities in eastern Contra Costa County as part of the basis of their work. All of these things came together to kind of help inform the collaborative in terms of what it would be and what it would do. And we really, I think, took a lot of pride back in those early days in being able to bring together all different types of organizations, community members, government agencies, nonprofit organizations who are doing the important frontline work of addressing poverty issues directly, and businesses. And looking out through the audience this morning, I'm so delighted to see that there are so many people who have been here since the beginning of the collaborative, but also that these groups that we tried to bring together are still represented here with us this morning. And so again, thank you for your participation. About midway through our last 10 years, we were very fortunate to have the Tri-Valley Nonprofit Alliance adopt the Anti-Poverty Collaborative as a specific project and initiative. And it really gave the collaborative a new home, and we've been really working on trying to sort of build and restructure the collaborative to be active in the community under the auspices of the anti-poverty, under the auspices of the Tri-Valley Nonprofit Alliance. One of the other things that happened during this time was we were fortunate to engage with another important partner, which was the Alameda County Oakland Community Action Program, who at that time was under the direction of Estelle Clemens. And I heard she might be here this morning, but I couldn't see her in the audience. I'm hoping she might come because I really like to give her a shout out. One of the things that Estelle was able to do was to tell us and work with us to say, you know, if you're really interested in doing work, you need to be able to tell a good, comprehensive, and complete story. And so she introduced us to Paige Tomlin, who is sitting here in the front row, who is an outstanding researcher and helped put together our first Tri-Valley poverty profile, which was released a couple of years ago. Now, oftentimes when organizations put out reports like this, it's sort of a capstone, right? It's the culmination of effort. This is the exact opposite. This is designed to be the beginning of discussion and the beginning of engagement. One of the things we found, though, is that, you know, as time progresses, data changes. And so we realized that we needed to do work to update the report, and we're very pleased to announce that today we are releasing the updated Tri-Valley Poverty Profile. Out in the lobby, you probably saw some easels that have some of the highlights from the report, but you'll be able to get a full copy. We have a few printed copies here. We will also be sharing a QR code with you that will allow you to go directly to our website to download the current copy of the report. One of the interesting findings of the report is poverty hasn't left us. And it's a little bit surprising because one of the things that happened during the pandemic is we actually saw poverty decline. And the reason for this is there were a number of pandemic-related programs that got put into place that actually moved the needle significantly on poverty. But as those programs have terminated, we're starting to see poverty come back again in radically increased numbers in some cases, and very kind of disturbing. So we want to take this data from this report to help start a discussion across a variety of different sectors that are addressing poverty needs within the Tri-Valley. Again, the report is designed to start a conversation. So we would like to kind of use the concept of engagement with this report. And let me describe a couple of the ways that we'd like to have you use the report and what we hope to have happen as the report gets distributed. First of all, we want to be able to create some type of a common understanding about what the most significant issues are in the Tri-Valley. And again, Paige has done an enormously successful job of collating data that is out there to help talk about some of the different areas where poverty is very visible and where there are needs that need to be addressed. But it's not the full story. And one of the things that we really want to do is to engage with the service providers in the area and have them review the report and give us some critical feedback. Let us know where there's something that's missing. Let us know if there's information that we need to be looking at or that needs to be developed for our area to help address poverty issues. We really want to be able to kind of use this just as a base so that we can expand the discussion. The other really important function that the report serves is to help educate the community at large. And again, all of you play a very instrumental role in doing this. We really believe that as part of the effectiveness of the collaborative is to be able to have a common understanding about what the issues are so that we can work collaboratively and collectively to be able to address these. So your assistance in helping get this information out there, helping to tell these stories, helping to get that information out into the community at large to whoever you connect with is very, very important to us. One of the other things that we want to do is to help enrich the opportunities for our local nonprofits. And one of the things that we'll be doing shortly after the beginning of the year is to convene nonprofit organizations that are providing frontline services and get additional feedback from them about how can we increase the effectiveness of the reporting that we're doing, as well as the data collection, and being able to tell the story about where the needs are in the local communities. Excuse me. Finally, we would like to ask you to help spread the word by getting people to enroll in our communications program. We have a number of different bulletins that we put out. We have our social media platforms, we have emails, lots of different ways to tell the story. What we find often is that we're kind of sometimes talking to the same room. And so we want to push our communication out past the people such as yourselves who are here today and engaged to maybe people who hadn't considered some of the issues that poverty presents or how it may impact them directly. Toward that end, again, on that same QR code that you'll find both out in the lobby, and I think we're going to be projecting it up on the screen as well, you will have an opportunity to enroll in some of our communication platform, and we would really encourage you to do so. If you're not enrolled yourself, please do. But if you are part of a membership organization, if you're part of a community group, if you're engaging with the community in any way, please encourage your friends, families, and associates to likewise sign up so that we can start to spread the word and start to have a broader discussion. We also plan to continue events such as the one we are having today and that we had back in March. We're so delighted to have Sheila Burks come back again. She's amazing, and we're going to have a really terrific discussion here today that I think you'll enjoy and will help also expand your own knowledge base about things that we can do to address conditions of poverty in the area. With that, thank you again for your participation this morning. It is now my pleasure to introduce to you the TVNPA Board President, Marty Sutton, who will get our panel started. Thank you.
Good morning. At our last event in March, we had one of our audience members ask, why aren't there more elected officials or government officials in our audience today? So today I am so proud because we have a number of government officials, and I would like to acknowledge each of them. From Livermore, we have Mayor Marchand. Councilmember Carling. Councilmember Barrientos. City Manager Mariana Marshalla. Brandon Caldwell. Livermore staff Fran Resner, Josh Furman, Amy Walker, and Shelley Haynes. So they're all committed. And from the Livermore Joint Unified School District, we have trustees Christy Wang and Yanira Guzman. From Dublin, we have Mayor Hernandez, Vice Mayor McCorston. And from Dublin Unified, we have Christina Henning, Jasmine Schroeder, and Lori Olson. From Pleasanton, we have Councilmember Julie Testa. We have Deputy City Manager Alexa Jeffress. And Human Services Director Jay Ingram. From Assemblymember Rebecca Bauer-Cahn's office, we have Elaine Schroeth. And from Congressman Swalwell's office, we have Phil Tucker, Madison Watkins, and Ron Payne. And from Congressman John Harder's office, Rhodesha Ransom. So I want to say thank you to all of you for taking time out of your busy schedules to join us here today for this important topic. As Kathy shared earlier, we're joined by an esteemed panel of experts who dedicated their careers to addressing the very issues we're gathered here to discuss. It is my absolute pleasure to introduce them to you. First, we have Tiana Moore. Dr. Moore serves as a policy director of the Benioff Homeless and Housing Initiative. Her work revolves around evidence-based policy recommendations, primarily focusing on homeless solutions. With a deep-rooted passion for the community and an academic background that truly bolsters her fieldwork, Dr. Moore's contributions have been instrumental in shaping how we understand and tackle homelessness today. Next, we have Jim Pugh. He's the co-founder of the Universal Income Project, an organization that has been pivotal in pioneering universal basic income projects. With a strong belief that economic justice is attainable, Jim's initiatives have led to meaningful discussions about ensuring financial security for all. His innovative ideas challenge the status quo and open doors for newer, inclusive economic policies. And we have Dr. Larissa Estes White. Many of you will recognize her from Alameda County. She is now the Racial Equity Commission Executive Director at the Governor's Office of Planning and Research. Her work is at the intersection of public policy, racial equity, and social justice. With an astute understanding of systemic disparities and a vision for equitable growth, Dr. White's endeavors continually seek to balance the scales, ensuring everyone gets a fair chance. And many of you know Sheila Burks. She was our moderator and speaker back in March. She is the manager of equity and inclusion for the Alameda County Community Food Bank. With her at the helm, conversations take a turn towards meaningful engagement, insights, and solutions. Her dedication to equity is palpable, and her expertise ensures that every voice is heard and every perspective considered. As we proceed with our program, each of our panelists will bring forth their insights, experiences, and hopes for a future where everyone thrives. So to begin, I'd like to introduce Dr. Tiana Moore.
Good morning, everyone. I am so thrilled to be before you this morning. Thank you so much for having me. And Marty, thank you so much for the excellent introduction of myself and also all of my wonderful co-panelists. My name is Tiana Moore. I am the Policy Director at the UCSF Benioff Homelessness and Housing Initiative. We're a research institution that's embedded within UCSF, and we do a lot of research and work around housing, homelessness, and health, and understanding those connections a little bit better. My role within UCSF is really to take the really rigorous research that we do and get it into the hands of the community, get it into the hands of policymakers, so that we can kind of all collectively move forward toward evidence-based solutions to prevent and end homelessness for all. I'm very thrilled to talk with you all about the California statewide study of people experiencing homelessness. It's the largest representative study of homelessness since the mid-1990s. And this morning, I plan to talk about some of the key findings from the report, but the report is 90 pages. I encourage you all to scan the QR code here and download it and engage with it at a later time. There's also an executive summary available as well at that link if you are looking for a 6-page introduction rather than a 90-page introduction. So with that, sorry, I just want to make sure I can see the screen. There we go. So a little bit about the study origins. As I mentioned, the California statewide study of people experiencing homelessness, or CASPA for short, is the largest representative study of homelessness in the United States since the mid-1990s. And it was really conducted at a time where California was interested in making significant investments in homelessness, both services that kind of seek to support prevention efforts and also to end episodes of homelessness for individuals. And so we conducted the study at the request of the California Health and Human Services Agency, but I will I'll give a little caveat that even though we did it at the request of the California Health and Human Services Agency, we take full ownership of the findings and the presentation and the interpretation of the results. So a quick note about study methods before we kind of dive into some of the data that we have. So we were in the field basically for a year, in between October 2021 to November 2022, so kind of at the peak of the COVID-19 pandemic. In terms of where we were in California, we were all across the state, so every figure that I present today are representative of statewide estimates that we have. So essentially, we carved California into 8 regions and randomly selected a county within each of those regions, which stood in for the entire region. So essentially, with some of the statistical weighting that we did, it's representative of the entire state. And our target population were adults, so we were interested in understanding the experiences of those who were 18 and older, recognizing that the experiences of youth are very different than the experiences of adult homelessness. Overall, we conducted about 3,200 questionnaires across the state of California, and for about 1 in 8 participants, we invited them to participate in a more kind of open-ended conversation, a more kind of long-form interview that we conducted with them where they could give more open-ended answers rather than just kind of yes or no for some of these questions. We used a sampling technique called venue-based sampling, which is really just a fancy statistical term to say that we met people where they were. We were in encampments, we were in hot food lines, hot shower lines, libraries, and other places where people experiencing homelessness frequent. Most of the questionnaires were conducted in English and Spanish, but we used interpreters for others if there was a participant who did not speak either of those languages. And then finally, and perhaps most importantly, is that our work was guided by the community. We convened 3 community advisory boards that really advised us from survey development up until dissemination of results that we're doing right now. One of the 3 community advisory boards was comprised of people with either lived or living experience of homelessness. So now I want to give a little bit of context into our population before we kind of dive into some of the findings. Gives a little context as to what we're talking about. So in alignment with federal definitions of, or the way that the federal government categorizes people experiencing homelessness, 90% of our participants were single adults, and these are adults that were 25 and older that were not living with a minor child at the time of the interview. 7% of our participants were adults and families, and that encompasses everyone that's 18 and older that's living with a minor child at the time of the interview. And then finally, our transition age youth, or young adults I should say. These are folks that were 18 to 24 without a minor child living with them at the time of the interview. And I will just make a nod to the point that youth experiencing homelessness is a very different phenomenon. The tools that you use to kind of do a study for adult homelessness are very different than the tools used for youth homelessness. And so we have to make it very clear that we're not making statements about the size of the transition age youth population. We recognize that it's likely much more than 3%. And so I just want to give that caveat is that, even with the best of strategies that we use to kind of reach that population, they're still very difficult to reach. And even though only 7% of our participants were kind of classified as adults and families, when we talked to our single adult participants, many of them had minor children that just weren't living with them. So 30% of our single adults had minor children that were not living with them at the time of interview. And 8% of those single adults actually indicated that their homelessness status was the reason that their child was not living with them. So with regard to some other key demographics, so homelessness impacts communities of color far more disproportionately than any other communities. So with regard to our Black and Indigenous communities, we're far disproportionately represented. 26% of our participants identified one of their racial identities as Black, but if you look at California as a whole, it's about 7% of folks who do so. When we look at our Native American, Alaska Native, Indigenous communities, 12% of our participants indicated that Native American, Alaska Native, or Indigenous was one of their racial identities, but when we look across the state of California, it's only about 3% that do so. With regard to gender, most of our participants were cisgender men, 69%, 30% were cisgender women, and then finally 1% of our sample overall identified as transgender, non-binary, or gender non-conforming. When we look at our transition age young adults, that number is a little bit higher. So amongst our transition age young adults, it's about 6% who identified as transgender, non-binary, or another gender identity. With regard to age, I think it's important to note that California's homeless population is aging. Across all of our sample, the median age was 47 years. When we look at just our single adults again, the median age jumps up to 49. So about half of our participants were 50 and older at the time of the interview. And notably, about 41% of those who were 50 and older at the time of interview had never experienced homelessness before. This was their first instance of experiencing homelessness. So with regard to episode length, episodes of homelessness are long. The median length of the current episode of homelessness across all of our participants was about 2 years, or 22 months. And 1 in 3 participants met federal criteria for chronic homelessness. And for those who are unfamiliar with what chronic homelessness is, it requires both meeting a temporal criteria and also meeting a criteria of having a disabling condition. Perhaps one of the most common myths that I hear often when I'm on the road is that folks are coming from other states into California, and that's who are predominantly our population of people experiencing homelessness are. But we found quite the contrary. So 90% of our participants indicated that they were last housed in California. And we also found that people aren't moving these great distances between where they lost their last housing and where they currently were. So 75% of people that we interviewed were interviewed in the same county in which they lost their last housing. So a little bit about pathways to homelessness. I think it's important to note there's not a single trajectory to homelessness that people kind of go through. There are often multiple, and there's not a single, there we go. So I think with regard to entrances and trajectories, it's important to note that about 1 in 5 of our participants entered homelessness directly from an institutional setting. Most commonly, that was entrances from prison and from jail. About 49%, or about half of our participants, entered from what we call non-lease holding agreements. So these are folks who are doubled up, living informally, without their name kind of formally listed on a lease or mortgage agreement. And then about 32% of our participants came from what we call lease holding agreements, which encompasses both having your name either on a rental agreement or a mortgage. It was only about 3% of our participants who entered homelessness directly from a mortgage holding situation. So low incomes and high housing costs kind of combine and converge and really increase vulnerability to homelessness. So across all of our participants, in the 6 months prior to experiencing homelessness, the median monthly household income was only $960. And the median monthly housing cost reported in that 6-month period prior was about $375. But I think what this kind of understates is the fact that about 43% of our non-lease holding participants weren't paying rent at the time in that 6-month period prior to losing their housing. There's some differences in income and in housing costs that emerge when we look at non-lease holders versus leaseholders. The median monthly household income for our non-lease holders was about $950 in that 6-month period prior. And again, 43% of these folks did not pay rent in their last housing. But amongst those who did pay rent, it was about $450 was their contribution, which is roughly about half of what their income was. Leaseholders, it's the same story, just the numbers are a little bit higher. So the median monthly household income in that 6-month period prior to homelessness for our leaseholders was still low, it was $1,400, but their median housing costs were also a little bit higher, so about $700. So again, expending about half of your household income on rent. Our participants had very little warning prior to losing their housing. So across all of our participants, it was about 5 days. When we look at just our non-lease holders, across our non-lease holders, the median was 1 day of notice that they received. In our leaseholders, it's about 10 days of notice. So we asked our participants a myriad of questions around reasons for losing their last housing. We asked them to identify all of the reasons, and we kind of gave them some examples and also opened it up for them to kind of open-endedly share. And then we also asked them to pinpoint what they considered the single most prominent reason that they lost their last housing. What we see is that across all participants, it's about 12% who indicated that they lost their last housing because of lost or reduced income. But the differences really emerge when we look at non-lease holders and leaseholders. So amongst our non-lease holders, Typically, our non-leaseholders would point to these kind of interpersonal factors, right? They're doubled up, they're living in these less than ideal housing situations. But what really came clear when we kind of expanded that conversation in the qualitative interviews was that an economic factor was the upstream reason that they were actually living in these tenuous situations, less than ideal housing situations. So even though they may have pointed to this being the immediate trigger, really what we heard is that years before, their economic situation really kind of influence their trajectory to these less than ideal housing situations. When we look at our leaseholders, it becomes a little bit more clear that loss or reduced income, at least amongst our leaseholders, was the primary reason. About 1 in 5 of our participants that were leaseholders indicated that that was the reason that they lost, the primary reason that they lost through last housing. And even though we asked our participants to pinpoint one reason that they considered their primary, what really is clear is that multiple reasons often intersect and contribute to housing loss. So I want to share a quote from one of our participants. Basically, I just didn't have enough income. You have to have first, last, security deposit, and I didn't have it all. And then the disability. After my parents died, I was on my own, so then I really started to suffer and see all the hardship you have to go through to get housing and with a disability. So the intersection of health, social reasons, economic reasons all converge to precipitate housing loss for this individual. We also asked our participants about help sought and received in that period between them understanding that they were going to lose their housing and then becoming homeless. 36%, or about 1 in 3 of our participants, indicated that they sought help from any source, and this was most commonly friends and family. And 23% of our participants actually said that they received help. These numbers were a little bit higher for our adults and families, where I believe about 61% indicated that they had reached out for help beforehand, and a little bit higher for receiving help as well. So I want to take us back to the 1 in 5 participants that we had that came from an institutional setting directly into homelessness. And this again was primarily from prison and jail exits. So we asked our participants that were left these institutional settings kind of what help they received, both in signing up for benefits, signing up for healthcare services, and then finally looking for housing. And we were very generous with how we described help. It could literally have been a handout that someone gave you with resources. And across the board, across all of those 3 domains, less than 20% of all folks exiting prison, less than 20% of all folks exiting jail actually received help in any of those domains. Sorry, I'm having a little clicker issues. Here we go. And then finally in this section, when we talk about trajectories and homelessness prevention, we put our participants through a little bit of a thought experiment, we like to say. We asked them to kind of take themselves back to that 6-month period prior to losing housing and thinking about what would have helped stave off homelessness for at least 2 years for them. And so we gave them 3 hypothetical financial interventions that might have helped. And we asked them to respond, do you think this would have helped keep you stably housed for that period of time? 70% of our participants thought that just receiving a $300 to $500 monthly subsidy would have helped stave off homelessness for at least 2 years. 82% of our participants thought a $5,000 to $10,000 lump sum payment would have helped stave off homelessness for them for at least 2 years. And then finally, 90% of folks thought that a housing voucher, similar to a housing choice voucher, which limits your rental contribution to about 30% of your income, would have staved off homelessness for them for at least 2 years. And finally, I want to talk a little bit about some barriers and facilitators of returns to housing, returns to permanent housing that our participants identified. So overall, nearly 89% of all of our participants indicated that high housing costs were the primary barrier to exiting homelessness and re-entering housing. When we think about it, to give a little bit of context into employment and income during this current episode of homelessness, across all of our participants, the median income that they reported monthly during this current episode of homelessness was about $400. But our participants spoke to these really lengthy disconnections from the labor market, both the informal and formal labor markets. So 70% of our participants hadn't worked 2 or more years, or 20 hours or more a week in 2 or more years. But folks were actively looking for work. So 44% of all of our participants were actively looking for work at the time of interview. But when we look at kind of the working population, those who are kind of 62 and younger, and also when we restricted by looking at those who don't have a physical disability, about 55% of those individuals indicated that they were actively seeking work at the time of interview. Across the board, a contributor to these kind of low incomes that are reported is just kind of an underutilization of income benefits that they're eligible for. So we kind of hypothesized who might be eligible based on some criteria that we had available. And then we looked in utilization rates across the board for income benefits, SSI, SSDI, GAGR, very, very low. Our participants also talked about some other key barriers to exiting homelessness. 53% talked about this lack of housing relevant documents. So having your ID, things of that nature to be able to actually apply and receive a unit of housing. 52% talked about wait lists being too long, whether they be wait lists for a housing unit or wait lists for a voucher. Family and friends not able to have the participant live with them also emerged as a primary barrier. 51% of participants said so. And credit history or past evictions, about 49% of our participants indicated that that was a significant barrier to them exiting homelessness. About 1 in 3, 36% indicated that a carceral record was a barrier to them exiting homelessness. 29% indicated that mental health or substance use issues, a behavioral health issue, was a reason that it made it more difficult for them to exit homelessness and enter into housing. And 24% indicated that a physical disability limited their ability to exit homelessness and enter housing. One of our participants talked about this kind of sense of hopelessness that they feel with the long wait list. So they said, they tell us, you're on the waiting list and all this. It's been 3 years. How long can the waiting list be? We should be priority according to what the news says all the time. We should be priority to get us off the streets, and they don't. Some of these guys have been out here for 20 years. I understand you get the elderly and those out of the way, health conditions, but they tell us the same thing all the time. You're next, you're next. It's just stressful. With regard to support finding housing, 2/3 of our participants indicated not having someone to help them find housing was a barrier. Only about half of our participants indicated that at some point during their current episode of homelessness, they received formal assistance trying to find housing. But when we look at frequency, it wasn't very frequent. So only about 1/4 of our participants indicated that they received that help in the last month, at least once in the last month, in the past 6 months, we should say, monthly or more frequently. And this was a lot more common for our folks who were living in sheltered settings. So 44% of our sheltered participants indicated monthly or more frequently being in contact with a housing navigator or case manager to help them find housing, but only 20% of our unsheltered participants indicated so. And then finally, we engaged our participants again in another thought experiment, but this time to think about what supports they might need in order to exit this current episode of homelessness. So about 86% of our participants indicated that a $300 to $500 monthly subsidy would help them exit homelessness. This is not by saying this is the only thing, but saying one of these things would be helpful. 95% indicated that a lump sum payment of $5,000 to $10,000 would have. And 96% again thought a housing voucher would be really instrumental in helping them exit their current episode of homelessness. 94% indicated that housing navigation would also be very helpful. And finally, I just want to take a little bit of time to talk about a little call to action. So we have a 90-page report, lots of data, and lots of policy recommendations that are also in the full report, but I want to highlight a few that I think are really overarching and really essential. We really need to think about all the things that we can do to increase access to housing that's affordable to our extremely low-income households across the state of California. Again, as a reminder, the median household income in that 6-month period prior to homelessness is just untenable, $960. I don't think anyone in this room could think about living on that as a monthly income. And that's, increasing access has multiple levers that you can kind of pull. We need to think about producing housing, and we also need to think about ways to make the existing housing stock that we have more affordable and accessible to those currently experiencing homelessness. We need to think about targeted prevention. As we saw in these kind of thought experiments, there's very little, at least participants thought that very little financial support would have actually helped stave off homelessness to begin with. We also know that folks are entering homelessness directly from institutions. That's a great opportunity to really disrupt the cycle that we see. We need to think about increasing household incomes, again, through both employment-based supports and also through making sure that folks are actually signing up for the benefits that they qualify for. And also, a sense of hopelessness and disconnection really emerged from talking to our unsheltered participants. We really need to think about ways to engage folks that are outside, currently suffering outside, thinking about ways to make sure that they feel supported. And then finally, and I think this undergirds everything, we need to really think about embedding a racial equity approach to any solution to homelessness, making sure that the systems that we set up don't unintentionally exacerbate some of the disparities that we see, and also making sure that the housing market, that folks are able to engage with the housing market in a non-discriminatory basis. And with that, thank you all so much.
My name is Jim Pugh. I'm a co-director at the Universal Income Project. We are based in Oakland. I'm very excited and honored to be here with this amazing panel and get a chance to speak to y'all. So before beginning, can I just get a show of hands? How many folks here are at least somewhat familiar with universal basic income or guaranteed basic income? Okay, so most folks here. I'm going to briefly run through, talking through what those terms mean, but most of my talk is going to be about digging into the rationale for why we are talking about that policy, and also some of the different pilot programs that are either currently or very soon to be launching in the Bay Area. So let's see if I can figure out how to make this work. There we go. Okay. So I started Universal Income Project 8 years ago. And at that point, it was seen, guaranteed basic income was seen as an extremely fringe idea. There was not a whole lot of conversation. The idea of giving people cash without strings attached seemed pretty ludicrous in most of the conversations I had with folks. But over the 8 years since then, I've seen a very marked shift in the way people in our society think about how our social contract should work. And so I believe we actually are on the precipice of reimagining what the American social contract can be. I think that what we are working to build is something that is much more rooted in both empathy and evidence. And it challenges these tired myths that have for so long driven the policies that we've created in our society about how we support people. So myths that say poor people are struggling because there's something wrong with them, there's personal failings, when the reality is they're living in a system that has been set up to push them and keep them in that place. Myths that say promote racial caricatures like the welfare queen of people abusing social programs, when the people on those programs overwhelmingly are doing whatever they can to take care of themselves and their families. And myths that talk about how people can't be trusted to figure out their own path forward if they are in poverty, when the truth is that if you give people the resources, they're going to do amazing things with them. And so at the heart of this new social contract that I believe we're moving towards is the program Guaranteed Basic Income. For those who aren't familiar, the way Guaranteed Basic Income works is that it provides people with cash, money that they can spend on whatever they want, no strings attached, and on a regular basis, at least monthly, and at a level that's enough for them to cover their basic needs. So instead of having to jump through a bunch of hoops and prove that you are deserving in XYZ capacity, and then to give me some support that you're only able to use for certain things. For example, our existing food stamps program that doesn't allow people to buy hot food. You give people cash they can use for whatever they want to address whatever needs they have. So we have gone in the past 6 years from basic income being something that most people thought was ridiculous to now having more than 100 pilot programs of basic income, guaranteed basic income, that are launching or have launched across the United States. Over 30 of those are in California and more than a dozen in the Bay Area alone. These are programs that are looking at what happens when you actually give people that regular cash payment. How does that affect their lives? It's, as you can see, it's happening in a lot of different places. The way the programs work exactly, how much money and how frequently is being explored differently in different locations. And the particular populations that are receiving that support is also being looked at differently in some of these different pilots. So I want to spend the last few minutes here talking about just a few of the examples of these programs that are being done right now in the Bay Area to give you a sense for what those look like. The first program I want to talk about is called the Abundant Birth Project. This is a program that launched in 2021 in San Francisco. And the program, the rationale behind the program is that if you look at birth outcomes for families in the Bay Area, in California, across the US, you see a distinct difference across race. And that Black, in particular, Black mothers have worse outcomes, even controlling for income. And so as a way of addressing this, this program provides low-income Black and Pacific Islander mothers in San Francisco with cash every month, $1,000, for over the course of 12 months. They receive that money starting from early into pregnancy until a few months after the child is born. This was inspired by work in Canada that found that giving low-income mothers, there's just $180 a month, already led to significant differences in health outcomes. They saw fewer premature births, they saw better health outcomes for mothers, and better health outcomes for the children. And so this program has been running since 2021. It's actually now being expanded to several other counties across the state as part of the statewide Guaranteed Income Pilot Project Fund. And so they have not yet released results, or wide results from the impact of their original program, but we have very good reason to believe that this is going to have a very positive effect on the people involved. The second program I want to mention is the Restorative Reentry Fund. This took place in Oakland. It's particularly looking at people coming out of the prison system, which is, as was mentioned, a group that is particularly vulnerable to falling into homelessness, to all sorts of poor economic and social outcomes, because these are people who don't have a stable platform when they return. You come out of the system, and oftentimes you do not have the resources to be able to figure out what does your life look like after that. And so this program provided people with monthly cash, initially $1,000 a month, and then going down to $500 a month, as a means of helping them get back on their feet. Another recent program was launched a couple years back in Santa Clara County. This was a program specifically looking at youth aging out of the foster care system. Again, a population that's in a transition point and that is vulnerable to leading to poor outcomes if they don't actually have the support and resources to chart their adult life forward. And so this program provided $1,000 per month for 18 months to 72 young adults coming out of the foster care system. And actually just very recently this summer was expanded to continue the original program and as well as to actually start providing support to other populations that are particularly vulnerable. And finally, this very much tying in directly with what Tiana was talking about, a program in San Francisco called Miracle Money that was specifically providing cash to unhoused people in the city. The initial pilot program was quite small. It only went to 9 people, giving them $500 a month. But, and they only received it for 6 months. However, over the course of that time, 6 of those people were able to secure permanent housing. And the program has received more funding. It's now being expanded, both in San Francisco and Los Angeles as well, to go to several hundred people. So, as I said, these are just 4 examples of the over a dozen programs that are launching across the Bay Area. There's a lot of different efforts right now to be able to showcase, really, not just to see, but to showcase how this cash can make a difference for people's lives, leading them to better outcomes. And I think we're in a moment now to do the exploration, to see the power of these programs locally, Ultimately, what the Universal Income Project would love to see is a federal program that guarantees that every member of our society has a baseline income to cover basic needs. Going back to the point about oftentimes as a people, just before they fall into homelessness, that money is most critical. And so making sure that that's there for everyone when they need it is ultimately where we want to go. But in the meantime, there's a lot of amazing work that can happen at the local level by looking at these vulnerable populations and seeing how lives can be transformed with a bit of extra regular cash. So I'm going to keep it short and sweet, and looking forward to the Q&A section of the panel. Thank you.
Good morning. I've been just sitting and reflecting after listening to my co-panelists talk about the ailments of our society, and yet I look in this room and I see the solutions. And how the solutions are always the ones that are closest to the ground. And that's what I'm here to talk about today, is really how do we better invest in our experts, each and every one of you that have been doing this work day in and day out, tirelessly, sometimes without pay, because we need to serve our community. This is humanity. This is period, point blank humanity. And what we saw in the pandemic was our safety net needing a safety net. Our government needed a safety net. Day one, what was that, March 17th, 16th? Next day, there were food distributions, meals being prepared, healthcare trying to get folks tested. But also there's unique housing solutions that came out of this. Project Room Key. How novel to take a hotel that wasn't being used and convert it into housing. It's kind of like common sense. I'm laughing because I'm sitting here like, we make things so complicated for ourselves. And yet, with the pandemic, we had to get smart and savvy fast, because each and every one of you in this room had people that were within need, or that had need. And I have this little picture here of these children, because the other piece of nonprofits and community-based organizations is, at the end of the day, each and every one of you create safe spaces. The efforts that you have in these communities create safety. And that is something that we're seeing rising time and time again in our communities. It's on the news, the media is talking about it, creating a huge narrative behind safety. And many of you in this audience, through the work that you do, create that sense of safety, that sense of trust. You bring dignity, you bring agency to many of the folks that you serve. Who are you? You're folks with lived experience. You center your clients or your patients. You are servant leaders. And I look at this room, and I think about all the work that each and every one of you put in. And I can't help but to really thank you. Because I don't think we would have made it through this pandemic without those of you that are in this room doing the work that you do. Yes. And it's despite all this. We saw this tremendous amount of federal and state funding coming down the pike. And there was flexibility behind much of that funding because, again, we were all scrambling as the government safety net. But it allowed people to be able to move how they needed to move to get the job done. That unfortunately went away. And a lot of times when it started to, the funds started to trickle away, we weren't thinking about sustainability. We were serving 1,000% and had to get back down to 75, and there was no sustainability planning within that. And I'll get to a little bit about why we have to think sustainability and some of the efforts that are out there to do that. The work versus the business. Nonprofit is a nonprofit, but it is a business. You have to figure out how to pay yourselves, strategic planning. But then you also have to serve. And there's this constant competition, particularly amongst nonprofits, about, I got to do the business of a nonprofit, but there are people out here in need. And that tugs at your heart every single day. We could probably spend a whole day here talking about varied funding streams and reporting requirements. Same agency, maybe even the same program, and you have 30 different ways you can report. We have to do better. And I was literally at a meeting yesterday in Sacramento, and they brought up an example in New York where they're working with nonprofits, and New York has basically created a model where there is a single application to support, a certain program for nonprofits, and it is the government's business to figure out how to best fund them. Isn't that novel? One application. Yeah, we make this hard on ourselves. And government has the opportunity to streamline that. And that is a racial equity issue. That is an equity issue. Complex contracting, the need for attorneys, insurance that you've never heard of, all to get like $10,000. You need $1 million of insurance to get like $10,000. Math is really hard and it is not my ministry, but that doesn't make sense. This is my favorite, delays in reimbursement.
Yeah.
And that you have to pay upfront costs. So we are out here on boots on the ground. I see my friend Ronnie here, he always tells me boots on the ground. You mean I have to do all this work with no kind of starter capital? And then I have to wait 6 to 9 months, sometimes even 18 months to get a check back. Again, we make this hard on ourselves. And I'm saying we, the general system. And some of these challenges with the general we and the general system is the populations that you are out here to serve. These systems were not built for them in the first place. So while we talk about capacity building, fundraising, the things to address the issues and to create the programming that my panelists have talked about, we've got to fix our systemic issues. I hate the term administrative simplification, but that's exactly what it is, like paper pushing. And we don't ask ourselves why. I'll talk, limited funds, general operations is huge. You can find funding for any type of program you want, but then when it comes to actually funding yourself to keep the lights on and make sure your staff are paid, is really difficult. I don't know if there are any academics in the room, but we see academics charge like 55%. I actually heard somewhere upwards of 68% indirect costs. And when we're hearing nonprofits having to only do 10 to 15, if they're lucky, 20. We perpetuate this inequity within our systems. And then the mission creep, just to stay afloat. I've always wanted to think about what are the things that I could do to, steal from Peter to pay Paul so that we could just keep the work going. We shouldn't have to think about that. And then as nonprofits, you do that every single day. And what we've seen is a tremendous focus by philanthropy and government on capacity building, which is great. We're seeing them center community-based organizations. There's a little bit of more increased transparency about the how and the why. There's a little bit of streamlining, not a ton. We're seeing more creative reporting. The idea of not having to have 300 measures and like a 20-page report, but rather, let's talk about real impact. Let's share the images. Let's do site visits. Let's really understand the impact of what your funding is doing. We're starting to see commitments in power building, and that's actually eventually what I'll leave you with today, is the power that is in this room. And ensuring dignity, not only as nonprofit leaders, but also ensuring dignity amongst those that you're serving. how novel is it to receive some guaranteed income with no strings attached, and that you actually take care of what you need to take care of. I mean, if you think about the paychecks that we get, we do the same thing. So that narrative that we are hearing, that you can't trust people, that they're looking for a handout, it is grounded in anti-Black, it is racist, and it is what is perpetuating our inequities time and time again. So how are we going to solve this? I'm not sure yet. And I somehow landed a job to try to figure that out. When I was in Alameda County, I joked, I've been brought on to end poverty in Alameda County with like a little bitty of a budget, and here I am being brought on to end racism with another little bitty budget. I'm like, how do you end racism with 1.4 million that's shared? And yet I hear about the $600 million that are going to housing, which all of course are important. But many of the programs that we are working on, whether it be at the state, local, and federal level, all require a lens of racial equity. They're supposed to touch the most marginalized, those who are most under-resourced. Yet time and time again, we often see the same larger nonprofits. This is no knock on big nonprofits. They have the resources to get the funding. So some of the things that we're going to look at with the Racial Equity Commission is really identifying what are those resources, those best practices to help inform decision-making at the state level, and the idea that hopefully we can start to work with local jurisdictions on this. We're looking at budget and strategies to adequately allocate funds. When you look at race and disaggregate the data, we can disaggregate data. It is okay. We can make informed decisions on that. There are certain ways that we have to shape how we talk about that due to Prop 209. But we need to use data to inform our work. We need to be sure that we're meeting people where they are, and that's that stakeholder engagement that we'll be doing. Part of my role is to ensure that we are meeting community where they are. As much as this is a formal government commission, has 11 commissioners, we are subject to Bagley-Keene, which is also known as the Brown Act, so everything we do is public. Part of what we also have to do is make sure that we are understanding and recognizing what does equity look like and what does inequity look like. And that is learning directly from the communities that you all serve. The bigger piece of this, and this is the one I'm very excited about, is how do we help others on their racial equity journey? And so in developing these tools and frameworks, which will become public, I am hopeful April of 2025, that's when we have to turn it in, but it's government, there is no guarantee on anything. But this marathon of intention is critical to start to make those shifts in the racial inequities that the big system we have created and perpetuated, and that each of you every day try to undo. I hope that we look at contracting and procurement. How does the money flow? I want us to look at hiring practices and how are we creating workforce pipelines to ensure stable and wealth building employment. Not so people would just make ends meet, but to build wealth. And also ways that we are all speaking the same language around racial equity. There are a lot of different frameworks, all valid, but until we are speaking the same language and really grounding our hearts and minds as to why we're supposed to be doing this in the first place, and hell, why we even need to do this, we won't see the transformation that we need to see in order to eliminate those inequities. And many of you have seen the image. It's the image that everyone uses to talk about equity. And it's the fence with the boxes and 3 people, and equality is everybody having the same boxes. Equity is, the short person. I'm a short person. For those in the front, you can barely see me. I'd be on the 3 boxes. First of all, that's a hazard
to be standing on boxes over a fence looking at a game. But when we're talking about racial equity and equity in general, why is there a fence? Why are they standing on the outside looking in? I hate this graphic, by the way, I'm sorry. I want to be in the good seats. What does it take so I can get in the good seats and sit right behind the plate or first baseline? What does that take? That's what our goal is, or that's my goal, with the Racial Equity Commission. And it's your boots on the ground that help us get there. You are the front line. So what are the efforts that are out there to help support the front line? How many of you are aware of Cal Nonprofits and their racial equity bills package? Only a few, okay. This is a big deal. So Cal Nonprofits, during this current legislative session, put together, I believe, 7 or 8 bills to support nonprofits in ensuring that you all are able to move with intention and with equity. Of those 7 or 8 bills, only 2 have made it through the legislature and actually are currently sitting on the governor's desk for awaiting signature. The first one is advance payments. And the idea behind this is to prioritize recipients serving disadvantaged, low income, and you'll hear me talk a little bit about narrative in a bit, underrepresented communities, to ensure that they receive upwards of 25% and meet certain level minimum requirements in advance. And this is state money. There is potential impact for local jurisdictions that receive state money, and that they would have to follow those same rules. Again, awaiting signature on the governor's desk. He received it on September 20th. That's my boss, by the way, but I still think it's important for accountability. The second is equity and prompt payments. And the idea behind this is within 45 days of a state agency receiving an invoice. 45 days, wow. Especially when y'all are used to like 6 months, if not longer. 45 days of prompt payment. What does that look like translating into our local jurisdictions? There's a lot of work behind that, and I get it. But picking small things like this and figuring out how do you replicate it, how do you adopt it to meet your own needs within your own jurisdictions is really important to think about. If we aren't paying our nonprofits in a timely manner, the tax dollars come in all at the same time. If you're a government employee, you get paid on time. We should offer that same level of dignity and agency to our nonprofits. And I'll leave you with this. Check out Cal Nonprofits Equity Initiative. If you are so inclined, look up the bills. When it's still pending signature, the governor's office still accepts letters, phone calls. And part of this is building the power not only within yourselves, but also within the people that you serve. This room has a tremendous amount of power that can create that transformation that we're looking for. And we are really on this journey of incremental but necessary change. And without each and every one of you in this room, that change can't happen. I'll leave you with that. I'm looking forward to our panel discussion and hearing your questions. Thank you.
Good morning. Good morning. My name is Sheila, and I'll be leading us into a conversation. But first, what I'd like to do is invite you to Brave Space. This is an invitation to Brave Space. Together we will create Brave Space, because there is no such thing as a safe space. We exist in the real world. We all carry scars, and we all have caused wounds. In this space, we seek to turn down the volume of the outside world. We amplify voices that fight to be heard elsewhere. We call each other to more truth and love. We have the right to start somewhere and continue to grow. We have the responsibility to examine what we think we know. We will not be perfect. This space will not be perfect. It will not always be what we wish it to be, but it will be our brave space together, and we'll work on it side by side. So a few additional invitations. As we enter our Q&A, and I'll kick us off with an initial question for the panelists, speak your truth, and please allow others to speak theirs. Together we know a lot. As all of the panelists have said, there's so much wisdom and so many stories in this room alone. We are powerful together. No fixing, no saving. And related to that, we want to turn judgment into wonder. Let's engage our curiosity this morning. Yes, we embrace imperfection because we struggle together to get better. And finally, we expect and accept non-closure. Poverty and racism are still going to be on the other side of that door when we walk out of this room with all the love that's here. What are we going to do about it, is the question. What are you willing to do?